Welcome, Yara.
Hi.
Hi.
How are you?
I'm fine. How are you?
Good, good. I'm well rested.
Oh, good. After Halloween?
After, not even after Halloween, this Thanksgiving break has been joyful.
Oh, good. Good.
Yeah.
So this is November. We've done September, we've done October, and we
Mm-hmm.
finished at Halloween. So this is your third month in PA school.
It is, it is.
So let's dive right in and let's
Yes.
get caught up with what's in Yara's life.
I know, I know. This month has been good. I'm currently on break. I have a couple of days left, which is nice. We kind of have
Okay.
near the end of stretch. We're kind of near the end of stretch of Thanksgiving break, but we kind of have another one later in December. It was nice. November has been kind of my dissection. I'm a C dissector, so it's been heavy for
What
me.
what what is a C dissector? That's your group?
Yes, so we
Okay.
have A, B, and C dissectors. A dissectors dissect twice on the first exam. B dissectors dissect twice on the second exam, and C dissectors dissect twice on the third exam. And the third exam
Okay.
is usually four dissections total. So this was heavy for me. I was
Ah.
in the lab too much. Yeah, it
So
was.
what section? Because the last time in October we talked about you dissecting the back, the shoulder you were exposed to, and you did the brain and the cranial nerves and stuff like that.
Yeah, so a different group dissected the shoulder. I just really enjoyed it. It was actually really
Okay.
as you got to learn the brachial plexus. But for the second anatomy exam, I got to dissect the brain and the face. The face wasn't kind of that heavy on the exam, but the brain was pretty much the whole thing. And then the end of October is when they kind of had us start, like the last 2 days of October, they had us start the back. But we really couldn't demo it or present it until November. So November is our last two sections, and we dissected the back, and we got to see the spinal cord, which is
Oh
really
wow.
it was really really cool. I lost it. I was so happy. The professor just saw my face lit up. I was so excited. And then our last dissection ever was the legs. It was really kind of more the gluteal cleft thigh and legs and foot. Um,
Okay.
it used to be two dissections in one, so they didn't want us to do too much. So they kind of condensed it in a way that made it equal to other students too, that we weren't doing the most and kind of not make it equal for each dissection. So we didn't get to dissect all the way down to the foot. We really just stopped kind of at the ankle, found the major artery there, exposed some ligaments, and then we were kind of done. But my favorite dissection between those was the back, just because I thought it was so much fun. And the back muscles are interesting. Like you open it, kind of you flip it like a book. It
Yeah.
was really cool to see. The leg, not so much. That was not my favorite dissection. I was really hoping for a dissection that I really love to kind of say, my goodbyes to anatomy with, because at this point we're done with anatomy, which is that's probably why you see my face all energized,
Yeah.
because I'm not exhausted anymore. But yeah, finishing anatomy, I just still don't believe it. I mean, we finished so recently too. We took our last exam, which was again two of my dissections, and then some of the B dissectors did more stuff with the hand, and the A dissectors had to do another dissection. I'm not entirely sure what they flipped theirs around a different time, so I'm not entirely sure what they did, but it was interesting. We were in the midst of our last dissection and had three exams and two
Ah,
presentations. And you're down there in lab for so many hours that by the time you leave, you kind of your brain can't do anything else. And so it was a good lesson to learn on like time management, because
yeah.
a lot of people were able, especially the people that weren't in my dissecting group, they had kind of the freedom of time to catch up on studying for all these other classes that we took. But we didn't really have that option. So we really had an exam on Monday, a presentation on Tuesday, an exam on Wednesday, a presentation on Thursday, an exam
When
on Friday. Like it was just like that.
when you
Yeah.
say presentation, you are the one giving the presentation?
Yeah, we took this class briefly. We took like a few classes. It was called bioethics. They combined us with the genetics counselor students for that class, and we only really took four classes. But part of that class is we had to give a presentation about a topic. But also for anatomy, you kind of give a presentation about your dissection too. So while you have other exams to study for, you actually have to memorize your dissection and everything that you did, because what they'll do is, for example, for the back, they give you 6 objectives for every dissection. And they're pretty lengthy.
Yeah.
Each objective is, if you're talking about muscles, that's lengthy. If you're talking about blood supply or nerves, I mean, or lymph, I mean, a lot of that stuff can be pretty lengthy. So you have to be able to show it to them if you're talking about blood supply in the leg or nerves that supply muscles in the back. You have to be physically able to show it to them, but also demonstrate like where it's branching from, where it goes, what it supplies, what the actions are. And so you end up being in lab really a lot of hours because it's almost easier to memorize it when you're looking at it.
Yeah.
My partner Janie and I would sit together the whole time, and we would go over it again and again. And then one of us would be stronger in something than the other. So we would always hope that we would get the objectives that we're stronger in, but you never
You
know.
never know.
They randomly give it to you because they want to make sure that you're able to peer teach it. You have to go back and teach it to the people that dissect with you at the table. So the back we thought was the most fun. I think it was at a time where there was a lot of stuff going on, and the back was relatively simpler to dissect in terms of what the expectations were.
Bigger muscles too, not just those.
Yeah. And then the legs, the legs are bigger muscles, but it did not spark so much joy for me, but that's okay.
Yeah.
Not every dissection I'm supposed to love. So
Yeah. Well, I'm partial to anything that's related to spine, brain, anything neuro. I'm partial to, and it comes easier.
Yeah, I was loving it. They came and did the laminectomy, so we would be able to see inside the spinal cord. And the minute that they did it and took it out, and we just like cut through the dura mater to see it, I just like, it was like Christmas morning for me. The professor saw my face and he was like, "You look like somebody that's just, fell in love with something." And I was like, "I think I did." It's gorgeous. It's just seeing it was so beautiful. So to leave that and move on to the legs, which again is mainly just muscles. I'm realizing that maybe I don't like muscles that much, I think is the problem, but it was still interesting too. A lot of our cadavers had knee replacements, so it was really cool to see. But for the last exam, they will tag. We have 9 cadavers in lab, so they tag 24 questions. So they try to make sure they tag all the bodies because they have to. And my partner and I were secretly hoping they tagged some of the stuff we dissected, which they did. And it felt so, yeah, they out of our entire body, they only tagged things from what her and I did. Which makes you feel good because that means you did a good job, and it was like good enough for them to tag it. So they tagged.
And you know the subject already. You know that material.
Oh yeah, I didn't have to read the question. I was like, great. I was like, and they tagged part of the spinal cord of ours. Not that we had. I mean, you open it and it's there, but ours looked really good, I guess, enough to tag it. So they tagged ours, and then they also did tag another muscle in our legs. Which, for somebody that didn't love dissecting it, I'm so glad that they tagged something that I knew because we had to present it. So that fell during that week. We were also dissecting at a time when the group before us was also dissecting, which happened pretty frequently with the C's and the B's, just because the way the weeks fell, there were a lot of times we were all in lab at the same time. So instead of 18 people, you were having double the amount of people.
Yeah.
Of 4 people at a body. So it was getting to be a lot. But when we were down there dissecting and they were down there dissecting, neither groups were studying the other people's material. So that's why it was like November was more busy, just because you had to focus on presentations, but also like I had to memorize my stuff, I had to memorize their stuff. And it just came at a funny week. I think they were really trying to structure everything to where we go home for Thanksgiving break and really do rest, which I appreciate. But we also had like 6 exams in less than a week and a half, which was crazy. So every day it was just like next, like you could not take a break. But finishing anatomy feels weird. I need time to process that one. I think I really want to be a teaching assistant just so I can go back in there and
wow. So there's not a test that's waiting for you when you get back from Thanksgiving break. You've done all the tests for that unit. Okay, so it's really
Yeah. So no, truly Thanksgiving break felt like a nice break. I still have 2 more days left. I came home recently from Maryland back to Atlanta just so I can play catch up, because technically you're supposed to study on break, which that's how I took care of myself. I did not touch a thing. So I'm playing catch up the next couple of days, but they really bunched up all those exams before. So we had another physical assessment exam. We had an anatomy exam, 2 anatomy demonstrations that I had to do for the back and the legs, and another presentation, an anatomy exam, and the FMS exam. So we had like all that stuff going on from the beginning of November till November 14th was just kind of 2 weeks of being bunched up together. Um, but anatomy is done. So I think they really just wanted to give it to us and get it out of the way. When we come back truly for another week of school, like we don't really have much left. We have a big FMS exam, which is basically like 50% neuro and a little bit of cardio, pulm, renal stuff. And
Well, just for people who are listening, cardiology,
yes, cardiology, pulmonology,
pulmonology,
yes,
because
renal.
a lot of pre-PAs are watching this video
Yes,
as well. So it's
that's
not
true.
just PA students. So
That's true. That's true. So we do, the next chunk has been a lot of physiology. I think she made the exam, this last exam, just physiology heavy. So it's more system based. So we learned at least neurology so far, cardiology, pulmonology, renal, endocrinology. And then we come back to school next week and learn GI, or at
okay,
least a bit of GI.
gastroenterology.
And then that will be our last exam. So that the last really exam we have for this semester is pretty heavy. It's all that one class, the Foundations of Medical Science. We also have another exam for the physical assessment class, but that one isn't as heavy just because she did a good job kind of putting everything before too. We before Thanksgiving break, we also had a pretend kind of physical assessment exam. So they gave us 60 minutes to do a full head to toe exam on each other. So I'll go in, my partner is pretending to be the patient. I'll go in pretending to be the PA student. And I have a preceptor in the room who had also graduated from Emory. She was working in pediatric infectious disease. So it was kind of cool.
Yeah.
Which is a unique kind of field to get into, but she was proctoring it. She was kind of making sure that when I did the neuro exam, did I check all these things, and did I do them correctly? When I was listening to heart sounds, did I emphasize what part of the stethoscope I'm using? Did I verbalize like in more of an abnormal kind of setting what this would sound like? Because relatively, I mean the patient, the student is healthy. So we did that for about 60 minutes and kind of ran through the whole
Wow.
thing.
So you're not looking for any particular abnormality. You're just demonstrating your knowledge and your memorization of the physical exam from head to toe.
Yes. So they initially had it separated into two of those instead of it being a 60-minute thing. They had it separated into two sections, but there was a hurricane, I guess, that hit a while ago here. And it was at a day that we were supposed to do that first part. So instead, they bunched it up into that 60-minute one. And they know that kind of the assessment that we're doing is they're healthy. They just want to make sure that we like verbalize everything. So we really start off by doing the general assessment, the vitals, that recent and remote memory. Then we move on to skin, we move on to eye, ear, nose, throat, like all this stuff. We do cardiology, peripheral vascular. We just abdominal, musculoskeletal. Like I mean, we just do it all until like the 60-minute mark, which flies by. Yeah.
And you're supposed to finish all it within 60 minutes.
Yes.
Okay.
Yeah. So the expectation is that really in the real world, you're probably never doing this
No.
in-depth
Yeah.
physical exam. They basically want you to know the skills because what we're learning now for that class, kind of last week and a half of school, is more of the core exam. They're like, okay, the patient presents with ear pain. You're not gonna do like a a
Yeah.
cardiology exam. You'll be able to kind of narrow down what you need to narrow down. They just wanted us to have the skills so that we're next semester when we take cardiology or take pediatrics, we know what we're going into the room and doing because we won't have 60 minutes, nor do we
Yeah.
need 60 minutes if it's not related to what the
Correct.
patient needs. Yeah, so it was interesting too because there's stuff that you're verbalizing as you go. And I remember kind of being 20 minutes in, I had done so much of the ear and eye stuff, and then you just like it clicks to you that you forgot something. And then I remember I didn't do this, but a student in my class kind of was going through it, and I think they were doing the cardiology assessment. And they were like, and at this time, I'll assess hearing because they forgot to do it. So they were just trying to like verbalize that they know it. So they were kind of like going back, and they didn't really care about the order. They just wanted to make sure that you knew
Yeah.
what you were doing because this isn't a normal setting that you're going to be doing this all the time. And they understand that. And they
Yeah.
really good feedback at the end for, okay, if you had a patient normally do this kind of range of motion, especially if they're sitting down versus standing up, because some patients aren't able to stand up. It's just stuff like that that preceptors were really great at doing because they haven't been in class with us. They've just been in the real world. So they see us do these assessments that we've learned from the professor, but also give us feedback on like, this was great, but this is how you would do it if it was like actually a patient that can't get up or can't move
Yeah.
or has kind of some more of those challenges too.
So these are like real external examiners and who are practicing clinically in the real
Yeah.
world. So
Yeah,
they're
yeah.
just coming to see you, what you've learned.
Yeah, they're coming to make sure that we have it too. Because I think at one point, some people were assessing like recent and remote memory, and then we'd forget to ask those three words. And you're like near the end of the exam, and you're like, and what were those three words? It's just
What
like
what are your three words? Do you use the same three words all the time or you change it?
so for the purposes of this one, Sebastian is my physical assessment partner. We just picked three words together. What were they? It was like paper, rock, something else. I can't even, my recent memory clearly
So
is not.
I always use the same pencil, apple, motorbike. These are my three I've used since
Okay,
PA school
I'm gonna steal that.
to now. There's the same question I asked my patients. So that way I don't forget what the three words were.
Yeah. And
Yeah.
I have to remember that. I went home right we this was the last thing we took. And I went home right after to spend some time with my parents and kind of take a little bit of a break for Thanksgiving. And I took my stethoscope home. I sat them down. I was like, I need you to breathe with your mouth open. Now I need you to hold your breath. And it's just so funny because we'll be sitting at dinner and then I'll see my dad do something kind of from the corner of my eye. And I'm like, nope, we're assessing the cranial nerves now. Like, everything. So my poor parents have been like my patients for the past semester.
Well, I'm sure they made them happy if you bring a stethoscope and examining them too.
Oh my God, they love it. And I think they don't understand, like I'm too early in the process, so they get so excited and they come out with like the box of medicine. Because being from the culture that we're from, they're just, used to asking me all these questions about medicines that I have never seen yet, at least. I'm sure I will next semester. And so then they'll ask me, they'll be like, look at this, read this. What about this? Did you see my labs today? And I'm like, I didn't, no. So I think they think they have a free PA already.
Yeah.
They think I have a free clinic that's just open at all times. But it's been fun practicing with them, just being able to confirm the things. It's not like you just studied it for the purposes of this. Like it's ingrained in my head.
Yeah.
I'm this is something I'm sure I won't forget.
Yeah. Now going back, you said you had two presentations. One was the anatomy, and then you said one was in bioethics.
Yeah,
What was your topic on bioethics? What did you do?
mine was surrogate decision making.
What? Say that again.
Surrogate decision making.
Surrogate decision making.
Yes,
Okay.
they wanted us to do about any type of presentation except a PowerPoint,
Okay.
which was really unfortunate. The whole class wanted to do PowerPoints. So we did a video, which
Okay.
I hope never sees any type of social
Oh,
media.
I would love to tag that in this YouTube.
Absolutely not. No, that video, I'm embarrassed to show my own family.
Why?
Because my acting skills were so bad. Like this confirms that I do need to be in a field like this because every person that was acting in that video just could not act to save their lives, and which made it more funny. Like the whole class was laughing more about our acting than the topic that we presented. But it was funny.
So when you say surrogate decision making, was it like parents making for the children or like the husband making for the wife?
Our scenario was a patient that was unable to make their own decisions regarding their care. He had been diagnosed with cancer and it just had progressed to a certain point. And then he had a life partner. That was me. I was the life partner, but they weren't married. And he was estranged from his sister and he has no other family. And then being next of kin, the sister would have made the decisions, but we played it off as they haven't spoken in 15 years. So truly like
The
and
life
he
partner.
yeah, and we didn't have any kind of paperwork, I guess, in the story of being like him stating that he would want his partner to make those decisions for him. And so that was kind of the story. It's like, what's the law? What do you do in these instances? Who technically makes the decisions? And we said technically it would be the sister unless kind of we found information that said otherwise. And so that was kind of the topic that we did is we played that video.
Yeah, it's it looks like an exercise, but you'd be surprised how often we
Yeah,
encounter this in real life.
yeah.
We get patients who have no family or they're estranged from their family, and now they're in a position where they cannot make a decision, whether it be cancer or sometimes even trauma, in a car
Yeah.
accident or a gunshot wound, or they come with a brain tumor and they're confused and they're not able to make a decision. Now, it's not like, am I getting a shot or not? It's
No, it's serious.
surgery, radiation, chemotherapy. So it is good that you're going through all these exercises. And we rely on social workers, we rely on the risk management team in the hospital to help us guide, okay, where do we go from here?
Yeah.
Who do we rely on to make these complex decisions?
It was nice practicing it too, because I remember those topics coming up when we would even just have our meetings at work before school. And
Hmm.
obviously, like as a dietitian, that was not something I really had a say in, but it was always interesting hearing kind of in those discharge meetings that we had as a team, kind of what was going on and being able to practice it actually and learning the law, which I'm sure is different in every state. So that's obviously important to know. But it was interesting to do it. And a lot of other people did different topics too. I think we got lucky with ours. I think ours is a kind of a straight, like not a straightforward, but I mean, if there's a law and the law exists, this is what you need to do. And sometimes those ethical dilemmas make it hard. So it was nice kind of being able to show both of those things. Yeah.
That's good. That's good. Um, so you finished with your anatomy. I know it's too early to ask. You finished with your dissection and you enjoyed your lab.
Yeah.
I'm still going to ask, even though it's too early. How is your interest towards surgery now to this
I
point?
still like it. I really do. I think I got really lucky. I think, I mean, honestly, if I dissected the heart, I would have really loved that. I didn't get to do it. But the organs, the abdominal organs were the first things I dissected. Loved it. I mean, I was like, this is so interesting. And then I got to do the back, which was interesting. The brain, which you know how much I love the brain. So I got lucky in terms of, oh, I've always kind of been interested in a surgical route. And then I was in a setting like anatomy where I really 3 out of the 4 dissections I was really enjoying. And so I think it just confirms it. But we'll see. I have to take surgery next semester
Oh, good. Because
and see what they
you,
teach us.
you know my involvement in the surgical residency program, the
I do.
postgraduates, and I've always kind of tried to drag you into it. So we'll see.
Yes.
I have time. I have time to convince you.
You have about till what, 2 years from now?
Yeah. Right now, learn as much as you can because
No.
medicine, even though I say surgery, there's a ton of medicine involved in surgery. You never want to be a technician where you can cut and sew. You want to know about the clinical aspect. You want to learn the medicine aspect of surgery. So that way you treat the patient as a whole and not just become a technician where you just first assist.
And being able to kind of see the patient before, after, just having that relationship, I enjoy too. But I think the hands-on, just kind of looking back at how I learned this semester, the things that come to memory most are information about things I dissected. And my anatomy partner and I always talk about that when we study together. And she's like, I'm going to miss just being able to do it just and put that in my memory because everything in didactic is not really like that. I mean, up until the exam where you do an assessment or do some skills, you're really having to learn the content kind of in your own way and in a way that's going to click. So I think that's what I'm going to miss the most. And I'm hoping to be a teaching assistant if they'll have me to where I'll go back in lab and just say hello, be there. I'm never going to leave.
So now you're 3 months into PA school.
Mhm.
How much of it is true when they talk about PA school being a fire hose in your mouth and turning it full blast?
You know, I don't like that saying because I feel like it just sounds like scary and intense. And like honestly, I did hear that saying on during my orientation week, and it was kind of phrased like you phrased it. Is like, do you guys agree? Do you not agree? And like honestly, at that point, we wouldn't have known if we agreed or not. But I just feel like that phrase is so intense because then it's scary and it puts people off. And I mean, it is intense, but there's so much of it that I think I didn't walk in thinking it would be easy. And I think the reminder is that if this is something that you really want to do, and sometimes people's opinions change, and sometimes people are in it and realize that's not for them, and that's okay. But if this is really what you want to do, as intense as it is, you also enjoy it. And so a lot of my family members, when they're talking to me and they know how stressed I am and how busy I am, they also hear me say how much I'm enjoying it. And all my friends and all the people you work with that still talk to me, like they know they
Yeah.
know I'm enjoying it. So I think it is intense. I think when you haven't been in school for a while, and undergrad is not the same. Undergrad is more kind of laid back in terms of what we had to do and expectations. And you walk in, and for example, my exam next week probably has like 2,000 slides that I need to study, but you find a way and you
Hmm.
get through it. And if you remind yourself that other people got through it. So yes, it is heavy and it is intense, but it's all for a good reason. And if people that are pursuing it really should believe that they want this and should know that they really want this, because otherwise that stress of it could kind of take you down a notch sometimes. If you're really tired and you're really exhausted, the stress of it could overwhelm you. But I mean, we're all stressed and it's difficult, but I love
Hmm.
it just as much, if not more. So it's just kind of like knowing that if this is truly meant for you, it's all going to matter at the end. People have done it a million times. We're not kind of the first ones setting the pathway. And just knowing that if I've had it difficult at certain weeks, I know people ahead of me probably did. And now look at them and they're going into like their clinicals in 2 weeks. So I mean, you get through it.
All the teachers, all the lecturers coming and talking to you who are students of Emory before.
A lot of them too. Yeah. I mean, a lot of them are still are one of our primary professors. He's also my advisor. He works in the emergency department. He used to work in ortho and he teaches us. So he still does all these things. And another professor works in dermatology and teaches us, the one professor from foundations. I mean, and she worked in pharmacology, like pharmacy before. So she a lot of them do come back and teach. And really, I feel like I could have a really busy 2 weeks, and then the minute those 2 weeks are over, I'm like, oh, thank God, like I'm so happy, but like I miss it, or I miss this stuff. Like I already kind of miss the feeling of dissecting. I feel like I'm just gonna put my scrubs on and go back down there in 2 days. So it's all worth it, especially if you have a passion for it too, and you really know that this is what you want to do, because it's not easy. And it's not meant to be easy.
It's not meant to be easy, correct?
It's meant to be easy. This is not every profession is difficult in its own way, but when you're really practicing medicine, you have to look at the end of the day that this information is what's going to save a life. And so it's not meant to be easy. Saving lives is not easy, and it's not a joke, and it's not, you memorize it and you move on. Like you have to be able to kind of find a way that works for you to get this material down so that you can continue to practice it.
That's good. That's a good attitude to have, and good perspective that you're able to share with pre-PAs. Because that's all we hear about, right? When any student applying to PA school, it's like a fire hose put in your mouth and turning it full blast. But you put it in a better way, in a better light. So
yeah, and I mean it's scary. It's not like you walk in and it's just like this joyful thing. Like I mean, some weeks are really scary. Even going in anatomy, some people have a passion for it, and I'm very fortunate that I did too. But I mean, I've had friends who didn't dream and live of the day that they're going to be downstairs dissecting a cadaver. And so there's certain things that kind of with time you get used to. Whenever it's the first exam and the first stressful period, you're like really stressed out and you're not sure how to handle it. But then it happens kind of again and you're less stressed. Or even if you are stressed, you kind of just know how to handle that stress a little bit better too. I think it's also because I probably slept this whole week and feeling a lot better.
You feel rested.
I feel rested. I would wake up every morning, my sweet parents making me coffee. Like I was just watching TV shows with them all day. Like it's just, it's good to get a break too.
So when you came back home for Thanksgiving, was it like, oh, your parents said you've been studying busy, so you just put your feet up, rest, we'll bring everything to you, or you jumped and rolled your sleeves and helped in the kitchen and made the Thanksgiving meal?
I went to my uncle's house for Thanksgiving, which is pretty kind of traditional for our family. Like we've been doing that for
your parents came there?
Yeah, so my parents and I went to my uncle's house. He lives nearby in Maryland. They live close to each other. But in terms of like in the morning, my dad was getting me my cup of coffee every morning, and I will recognize that all the time. But I really do love to cook. I think that's kind of therapeutic for me. I always cook here too, so it was nice just not doing the normal routine of school. And there were some things I had to study and I had to look at, but it was also nice just kind of sitting and Christmas shopping and not having to worry about school so much, which is good. They gave us a pretty decent break. I mean, it was kind of structured funny because we had a lot of busy exams, and then they gave us 9 days off, and then we come back for a week, and then we go for Christmas break. So it was just, I wish it was kind of structured all together, but then again, it was so stressful that it's good that they separated it. But yeah, so I won't be here for long. I got like a week left.
Yeah, so what I'm hearing is our December video is going to be more fun than stress.
Yeah, there's truly in December, I have 4 classes.
That's it.
That's
How long are you off for Christmas?
I'm off from December 13th to January 6th.
Oh, wow.
I'll be going on a lot of fun trips, so.
Interesting.
Yeah.
Okay. So to recap our audience, just your November month, what all subjects did you learn?
For November?
For November.
For FMS, we did neurology, neurophysiology. We did endocrinology. We did cardiology, pulmonology, renal, heavy on the physiology. A little bit of pharmacology, but not as heavy for this go around. The 4 dissections that we did were the back, the legs, the arm, the hand, and the shoulder, which was kind of split funny, but it fed into that last part. And then For our physical assessment, um, we did more of the cranial nerves. We had learned neurology before in terms of more of those involuntary movements that we need to look out for, but we learned cranial nerves more specifically. And then we did more of a peripheral vascular assessment. And it was really that class was more so, hey, let's condense this. Let's get you to practice how to do this. So a lot of that class was less teaching, more we need you to go to suites and keep
And then
practicing.
you had a final exam where you did head to toe physical exam in 60 minutes.
Had
Okay.
to exam, yeah.
Oh, that's good roundup. Okay, what is it? Your didactic year, 3 months into it.
3 months.
Okay, well,
Yeah.
we'll have a fun video in December.
Oh
And
yeah. If you call me anytime in December, I think I'm gonna be not here. That's somewhere. So I have a lot of fun plans. So I'm
okay,
excited
good. We'll figure out a day to catch up in December.
for sure.
Okay. Well, I'm glad you had a fun Thanksgiving and you were able to be with your family.
Yeah, thank
And
you. A good
good
one as well.
luck when you get back in December, and I'll catch you then.
Sounds good. Thank
Take
you.
care, Yara.
Bye.
Bye.